Hair loss prevention. A full, healthy head of hair is central to many people's appearance and self-confidence. If it begins to thin or fall out, it can be distressing. Fortunately, there are several things you can do to prevent hair loss or encourage hair growth. The best way to slow or stop hair loss is to address the underlying cause, whether it's childbirth, surgery, or another major stressor. If examples like these are factors, hair loss can be temporary, telogen effluvium, in some cases. In other cases, the cause is more complicated. Diet. 1. Mediterranean diet. A 2018 study revealed that a diet containing raw vegetables and fresh herbs, like the Mediterranean diet, may reduce the risk of androgenic alopecia, female pattern baldness, or male pattern baldness, or slow its onset. Best results were observed when participants consumed high amounts of these foods, like parsley, basil, and salad greens, more than 3 days a week. 2. Protein. Hair follicles are made mostly of a protein called keratin. One 2017 study trusted source of 100 people with hair loss noted several nutritional deficiencies in participants, including amino acids that serve as the building blocks of protein. While researchers note that more studies are needed, trusted source, eating a diet rich in protein may help prevent hair loss. Healthy choices include foods like eggs, nuts, beans and peas, fish, low-fat dairy products, chicken, turkey. 3. Vitamin A. Vitamin A is partly made up of retinoids, which support healthy hair growth, trusted source, and influence the hair cycle. But it's dose-dependent, meaning that too much, or too little, can damage your hair. It's unlikely you'll receive too much vitamin A from dietary sources. So fill your plate with foods rich in vitamin A, like sweet potatoes, sweet peppers, and spinach, to name a few. Supplements. 4. Multivitamin. Scientists have determined that the following vitamins and minerals are important to the hair growth and retention processes, specifically with cell turnover. Vitamins A, B, C, and D. Iron. Selenium. Zinc. You can find daily multivitamins at most grocery stores or drugstores, or ask your doctor to prescribe one to you. 5. Vitamin D. One 2018 study trusted source noted that vitamin D is associated with non-scarring alopecia. Treating deficiencies may help with regrowth. 6. Biotin. Biotin, vitamin H or B7, is involved in fatty acid synthesis in the body. This process is essential to the hair life cycle, and you may experience hair loss if you have a deficiency. 7. Saw palmetto. Derived from the fruit of American dwarf pine trees, this herb may help men maintain levels of testosterone. A 2020 review of 7 studies found that saw palmetto doses of 100 to 320 milligrams could help hair quality, hair count, and hair density. The authors concluded that saw palmetto may help people with AGA, telogen effluvium, and self-perceived hair thinning. 8. Ginseng. Ginseng contains certain phytochemicals that may promote hair growth on the scalp. Further study is needed to recommend specific dosages. In the meantime, speak with your doctor before adding ginseng supplements to your diet. Hair care. 9. Regular washing. Washing your hair daily may protect against hair loss by keeping the scalp healthy and clean. The key is to use mild shampoo. Harsher formulas may dry hair and cause it to break, leading to hair loss. 10. Coconut oil. According to a 2018 review of studies, researchers believe that coconut oil may help prevent hair damage from grooming and ultraviolet UV light exposure. Lauric acid found in coconut oil helps bind protein, trusted source in hair, protecting it from breakage at the root and strand. Massaging coconut oil into the scalp may promote better blood flow and help with regrowth. 11. Olive oil. Olive oil can be used to deep condition hair, protecting it from dryness and associated breakage. Olive oil is also a central ingredient in the Mediterranean diet, which may help slow genetic hair loss. Consider applying a couple of tablespoons of olive oil directly to the hair, and letting it sit for 30 minutes before washing it out. 12. Gentle styling. Skip tight braids or ponytails that may pull on hair at the root, and potentially lead trusted source to excessive shedding. While you're at it, let your hair air dry to avoid irritating your scalp. If you can, avoid heat stylers, like curling or straightening irons, which may also damage or break the hair shaft. 13. Hair processing. Chemical treatments, like perms or hair color, may also damage hair and scalp. Ask your stylist about alternatives, like organic hair dyes and others that don't contain ammonia, peroxide, or parphenylenidiamine, PPD. Medical treatments. 14. Laser therapy. Low-level lasers may help improve hair density for people with genetic hair loss and loss due to chemotherapy. This option is also called red light therapy, and it may work by stimulating epidermal stem cells. You can find home laser devices on the market, and you may need to use the device regularly to see results. 15. Platelet-rich plasma. Injecting platelet-rich plasma, PRP, into the scalp helps stimulate growth in areas already impacted by hair loss. Blood is run through a centrifuge to separate out the platelets, and then injected into the scalp. In one 2014 study, 11 participants saw 30% more growth in thinning areas after 4 sessions. Pricing ranges from $1,500 to $3,500 for your first 3 treatments, and it's unlikely to be covered by insurance. Medications. 16. Minoxidil. Otherwise known as Rogaine, this over-the-counter, OTC, drug is known to help with hair loss. Apply the liquid or foam to your scalp each day. Side effects include scalp irritation and acne at the site of application. Rarer side effects include irregular heartbeat and blurred vision. 17. Finasteride. Otherwise known as Propecia, this prescription pill may help trusted source slow hair loss and even promote new growth. You may need to use the medication for as long as 12 months to see any results. It also has various side effects, including loss of libido and erectile dysfunction. People who are or who may become pregnant should avoid this medication. 18. Phenylephrine. Topical phenylephrine may help trusted source with hair loss due to styling by stimulating the follicle muscles to contract. This makes it harder to pull out hairs during brushing, for example. Unfortunately, topical phenylephrine isn't publicly available yet. Scientists have developed a specific formula called AB102 trusted source, but it has not been released. Other methods. 19. Essential oils. Essential oils may help reduce hair loss. A 2020 review trusted source noted that various essential oils, including chamomile oil, thyme oil, tea tree oil, and others, could improve conditions like alopecia areata, androgenetic alopecia, and psoriatic alopecia. Other essential oils to consider include lavender, lemongrass, and peppermint. Try mixing a couple drops of any or all of these oils with a couple of tablespoons of carrier oil, like jojoba or grapeseed. Apply to the scalp for 10 minutes before washing. But make sure to test any essential oils before trying the above. It's possible to be allergic to essential oils. 20. Onion juice. People with alopecia areata may see regrowth after applying crude onion juice to their scalps twice a day. While research on this treatment is limited, the juice did appear to promote growth in nearly 87% trusted source of participants in a small 2014 study. Scientists believe that hair-growing properties may have to do with the onion's sulfur content. 21. Massage. We know scalp massage feels good, but can it help grow your hair too? Maybe. One small 2016 study trusted source showed participants seeing results with as little as 4 minutes of massage a day over the course of 24 weeks. 22. Yoga. Hair loss caused by stress may respond well to yoga. Try these stress-relieving yoga poses to prevent and slow hair loss. Downward facing dog. Forward bend. Camel pose. Shoulder stand. Fish pose. Kneeling pose. Why does hair fall out? The hair on your head goes through a life cycle that involves growth, resting, and shedding. It's common for people to lose around 100 hairs a day. If you experience more sudden loss in patches, or overall thinning, you may want to see your doctor. Some shedding is temporary and may respond well to changes in diet, certain treatments, or lifestyle changes. Other hair loss may be more permanent, or not stop until an underlying condition is treated. Around 50% trusted source of men and 15% trusted source of women experience hair loss due to hereditary conditions like androgenic alopecia, male and female pattern baldness. These stats are based on research that uses terms like men and women to categorize study participants, and your gender identity may not line up with the terms it uses to describe your experience. Other causes of hair loss include medical conditions, alopecia areata, scalp infections, or trichotillomania, hair pulling disorder. Hormonal changes, from pregnancy, childbirth, menopause, or thyroid issues. Medications or supplements, those used for cancer, high blood pressure, depression, or arthritis. Radiation treatment, for conditions like cancer. Stress, physical or emotional. Styling practices, wearing tight ponytails or cornrows, etc.